Staggering information from the Atlanta-based Centers for Disease Control revealing 94% of people who die from the coronavirus had underlying health conditions.
Yeah, that's right. And these numbers are based on death certificates, which the organization says are more reliable as sources of data. Joining us live right now is Dr. John White, Chief Medical Officer for WebMD. Dr. White, thank you so much for joining us this afternoon. First question for you, can you help us understand the connection really between those underlying health conditions and why a person would get more sick or potentially even die from the coronavirus?
Sure. So as you know, COVID-19 is a respiratory virus that just doesn't attack your respiratory system. It also attacks your neurologic system, your circulatory system. So if you're already having some challenges due to obesity or high blood pressure, you're already in a situation where you're going to have trouble fighting the disease. That's why what we call these comorbidities are so concerning for people that might get COVID. Because when they do get it, they have a worse outcome because they're not able to fight it as well.
Just mentioned that those comorbidities, diabetes, obesity, it helps that virus surge through the body. Can this be an issue for children as well?
Absolutely. The good news is that we don't see as much obesity in children and diabetes. So they're not going to be at as much risk as some adults were. But the other ones, are also cancer. If you have a weakened immune system, and diabetes actually can cause a weakened immune system, you're not going to be able to fight it as well. That's the challenge when some people feel they're strong enough, they're fine, and they have a good outcome. But if they pass it off to someone else who isn't as well as you might be, they're going to have a worse outcome.
And Dr. White, I'm not sure if you can answer this question, but I have to ask this. As far as coronavirus, we're hearing reports from overseas that there was a case where a person was reinfected that had coronavirus before. Do you see that potentially being a widespread problem?
I'm going to be honest, we need more data. I'm not so sure. That's one case. We've seen one other case. What I think has happened there, that person had a mild case of COVID. So they may not have developed as many antibodies as you might if you developed COVID or if I did. So it is a concern, but it's one case, so we don't want to get too alarmed. But it's something that we're going to have to continue to watch as we think about the antibodies that you develop from an infection. Do they provide immunity? We've also seen cases the other way, to be honest, in terms of a recent study done on a fishing boat where those people that had antibodies had protection. So we'll have to tune back in a couple of weeks and see how we're doing on that.
It is a fluid story and it changes, it seems like, almost every day. Dr. John White, Chief Medical Officer of WebMD, we appreciate your insight.
Thanks for having me.
You're welcome.